months-long hiatus. I apologize. Life has been lifing, but we're back. Today's going to be a very different video. I'm trying something new, something different, just because it's not always easy to sit down and make a full-blown video. So I figured, you know what, I'll multitask. We're cooking jollof rice today, so I'll talk to you guys while I do some domesticated work around here. But don't worry, this is not a cooking channel. The dog is back. Anyways, without further ado, let's just get into it. Now, I will make this video maybe like a 2-part or a 3-part, just to break it up. That way it's not too long and the different things that I'll talk about are, captured and you don't have to sit for long. As always, like, subscribe, follow, share, whatever you want to do. One sec, let me lock the door. So the first part, I'm just going to talk about first some differences between nursing in Canada versus nursing in the United States. And the reason why I want to talk about this is because I've gotten a couple of questions from people or potential students or people who are looking into doing nursing, and the phrasing of their question just lets me know that perhaps this person just needs a little bit more guidance, a little bit more push. I won't be talking about the nitty-gritty of the differences, just the overall general things that I feel like are important to know. So the first thing I'm going to talk about is the nursing program itself. So in one of my videos, I talked about how they're basically, for the most part, at least two types of nursing. So you have your registered nurse, which is where you go to a university for 4 years, you write your exam and all that stuff. And then you have your practical nurse, and these nurses typically go to college and then they write their own exam, and that's pretty much it. The difference is usually their scope of practice. Now, typically in Canada, registered nurses, because their scope of practice is more, they get paid more money, right? They get paid. Now in the US, I have seen, and please don't take what I'm saying as Bible, especially for the US part. I just want to highlight some things. In the US, they seem to have different paths to be a nurse. They have their registered nurse, their practical nurse, their associate's nursing or associate bachelor nursing. They're different routes. And so if you are looking to leave your country, make sure that whatever you're researching, right? Let's say you want to come to you want to study nursing in Canada, for example, and you research something and you see something like associate nursing. I don't think they have that in Canada. So again, make sure that whatever information you're finding is relevant to where you want to go, right? Because, well, you don't want to waste your time. And I've also heard people in the States say stuff like, oh, we get paid the same if you're this nurse versus this nurse and versus this nurse. In Canada, overall, for the most part, registered nurses get paid more than practical nurses. I don't know the specifics or, the pay and how it works in the US, but sometimes because they have a gazillion ways to be a nurse or different nursing paths, their pays may overlap or it may or may not. Again, make sure you're not getting information. Error. Sorry. The dog is back in. Anyways, make sure you're not getting information that applies to a different country and then trying to, apply it in Canada. The second thing is, let's face it, a lot of people, a lot of us, myself included, when you're Googling professions and what you want to do, we're all looking at the pay, right? So if you go online right now and you maybe type up, oh, what's the nurse specialty or the nurse area with the most money, you will see something that will come up, and that would be like nurse anesthesiologist or something like that. Now, I don't want people who are, again, in these countries that aren't Canada and the States, you know, reading things like that and then getting misled. The truth is, as of right now, or at least as of this video, Canada does not have nurse anesthesiologists. So basically, these are nurses that give anesthesia to patients, you know, maybe if they want to have surgery or have a procedure done. You know, the nurse I think it's called nurse anesthetic, oh, whatever. I'm gonna put the name on the video so you can see what I'm talking about. So in Canada, the people that give anesthesia to patients are the doctors, right? So the anesthesiologist, which is a doctor who went to medical school, did the training. In the States, they do have programs that nurses can take to, you know, become nurse anesthesiologists, right? And they typically are at the highest ranking phase or whatever, highest ranking group. Now, if you're looking to come to Canada, we don't have those here. And so if your plan is to, you know, climb up and get to that phase, again, make sure that you're doing all this research to know, yo, that doesn't happen in Canada, so perhaps maybe look at schools in the States. Now, this is not to say if you come to Canada you can never do that. Like, you can always go to the States if that's what you want to take that program and that stuff. But again, like I said, as of right now, I don't believe that we have those types of nurses in Canada. And so if you go to the States to get that degree, you would not be able to practice in Canada. Then again, you can practice in the States. So if that's something that you're interested in, go ahead. But like I said, the main purpose of this video is to help you make well-informed decisions, right? So yeah, that's pretty much it, I believe. Nursing pay, right? So, you know, a lot of people say, oh, nurses make bank, nurses make this, nurses make that. Again, the pay and how it works in Canada is different from the States. So for example, in Ontario, unfortunately, they seem to have put this pay cap on how much nurses can earn. And the nurses right now, they're trying to fight it. I believe they struck down the bill, but the government is still trying to appeal. And, you know, anyways, I won't get too much into the specifics, but if you're trying to, you know, wage the pay of nursing in Canada as, you know, as a reason why you should go into nursing, or at least just something to consider, make sure that whatever statistics that you're reading, make sure it's reflective of nursing in Canada versus the States, because the truth is nurses make more money in the States than in Canada. It doesn't mean that nurses in Canada are living in poverty. It's just that the States, they make more. So if you're making your decision based on figures that you're seeing in the US, just again, you know, look into that properly so that you're making well-informed decisions. The other thing is the nurse practitioner route. Now, again, if you Google, you know, nurses that make the most money, the nurse anesthesiologists, they're usually like on the top end of things. And following closely are nurse practitioners. Now, yes, we do have nurse practitioners in Canada and in the States as well. However, as of right now, most nurse practitioner programs in Canada need you to have some experience as a nurse. In the States, there are some schools that you don't even need experience. As long as you're a nurse, you can go in and, you know, take them. There are also some schools that offer that program in the States online as well. So just overall a little bit more, you know, flexibility in terms of, you know, personally, if I feel like, is it good to go into the NP program with or without experience? To be honest, I have no idea. I don't know enough to comment on that. But if you're wondering why it's like that in the US versus Canada, I will say this. Overall, the US just has more opportunities, to be honest. Like, they have way more schools than Canada as a whole. So even though there's competition for certain programs, they're still competitive, but I'll just say that Canada just tends to be a lot more competitive just because there are limited seats, not as much as you would see in the States. So again, just to end this, in case you're wondering, oh, Joanna's, like, how can I tell the difference, you know, if it's Canada, if the information I'm finding, if it's Canada versus the US? Some tips and tricks I will say when you're reading the article or listening to the video, check out for, like, sometimes they tell you like the states or the cities that they're referring to. So if you're reading an article and it says Texas is in the United States, so, you know, not Canada. You can always just Google if you don't know what they're talking about, or you could reach out to whoever you're listening to find that out. And then when you're doing your search, make sure you're narrowing it down and putting like Canada in your, whatever it is you're searching. Let's say you're Googling like how much do nurses make. As a matter of fact, even put like province, like put like Ontario, put Alberta, because even within Canada, there are some differences, there are some variations. So that will help. Don't just make a general search, because if you just do a general search, 7 out of 10 times the information you will get applies to the US. So yeah, anyways, I hope this helps you with your search. Yeah, I wish you guys all the best. On to part 2. Okay, jollof rice done.